Welcome. I'm Dr. Jeff Borenstein. Everyone is touched by psychiatric conditions, either themselves or a loved one. Do not suffer in silence. With help, there is hope. Today on Healthy Minds,
it's not your fault. I thought, and you definitely can't handle it alone, and get help immediately, because that's the only thing that's going to help.
50% of young people will have some kind of mental health problem as they make the tortuous transition to adult life. I would say if there's distress involved and it persists, we don't care what the label is, come and have a chat and we'll work out together whether you need more expert help.
That's today on Healthy Minds. Healthy Minds is brought to you in part by the American Psychiatric Association Foundation, the Graham Beck Foundation, the New York State Psychiatric Association, and the New York State Office of Mental Health. Today we speak with Daniel Laitman, a young man who was diagnosed with schizophrenia at the age of 15. Daniel shares his experience living with schizophrenia and how, with treatment and the support of family and friends, he is pursuing his dreams. Daniel, welcome. Thank you for being here.
No problem, anytime.
You have schizophrenia.
Absolutely.
And I'd like you to share what that's like for you.
It's basically like having thoughts that aren't your own. It's not just hearing things, I do hear things. But yeah, basically like you have your thoughts right here and then boom, you have no control over the thoughts over there. Like somebody is speaking to you. You might not hear it at first, but it's always there in the back of my mind. I also have OCD, which is my OCD tic is when I touch something and I don't finish a thought, I have to go back and touch that thing again. And sometimes I pray and mumble. My parents get pissed about that, so I try not to do it as much as possible. Yeah.
And for these symptoms, you have ongoing treatment. Mm-hmm. Tell us about the treatment that you receive.
Basically, it's both medicine, therapy, and exercise. On a good day, I run like 3.1 miles.
A fun run.
Not so much fun, but.
Okay.
But yeah, I run 3.1 miles and I walk. See, look, Fitbit.
Do you remember the earliest types of symptoms that you had?
Absolutely.
Tell us about that.
Well, for a couple of years, I was really depressed and we all thought I had ADD. And actually, right now, there are two voices in my head. God, devil. When I look up, it's God, down, devil. And also, I would imagine like little vapor trails around people, and I wasn't allowed to cross that path until 30 seconds had passed, and I shattered. And actually, my most extreme symptoms, still to date, I woke up at 2 o'clock in the morning, stayed in a fetal position for 4 hours, wasn't able to put my head to the pillow. And actually one day I skipped my medicine and that was a disaster. I was out of sync for the whole day. Like the voices got out of control. The OCD was unbelievably strong and I wasn't myself. And also, when my parents really noticed the schizophrenia, it was at dinner, I remember that, and I was just totally dead to the world. My face, And my parents were like, this isn't Daniel, this is wrong. And I was adamant about it at first, and we couldn't find the right therapist. Not that my therapist at the time wasn't great, she's a lovely person and a great psychiatrist, but you know, it's just some things are not your expertise, and we found some great doctors in the field, and that helped tremendously.
And for these symptoms, you have ongoing treatment. Tell us about the treatment that you receive.
Basically, it's both medicine, therapy, and exercise. On a good day, I run like 3.1 miles, and I walk. So now I'm getting way more exercise. My weight's down, which is great. I was like 142, now I'm like 138.
So just for our audience, you're taking a medicine that's very helpful to people with schizophrenia, but sometimes can have what we call a metabolic side effect.
Exactly.
Which could cause weight gain. So you're taking other steps, such as additional medicine and exercise, to fight off that weight gain.
Yes.
And still have the beneficial therapeutic effects.
Exactly.
In addition to the medicine and exercise, you also have talk therapy? Tell us about that.
Cognitive behavioral therapy, actually, CBT.
And for somebody out there watching who doesn't know what that is, give us a paragraph on CBT.
Basically, CBT is fighting the tics that come along with OCD and schizophrenia to get me used to all the bad thoughts in my head, and showed me that nothing would happen. Like right now, I'm on camera, and for some reason when I'm on camera, or like I'm doing stand-up comedy or writing, all the symptoms go away. It's great, which is one of the reasons I do stand-up comedy. Not just that I love it and I'm pretty good at it, just saying. But yeah, it's my break. It's my break from schizophrenia. It's really nice.
I want to ask you about the stand-up comedy, because it sounds like for you, doing that is a type of treatment.
It is.
How did you get involved in stand-up?
Sadly, we know that Robin Williams passed away. And when he was still alive, basically my dad and I were coming home from a Yankees game, which I paid no attention to. I hate sports, don't tell. But yeah, we were on our way home from a Yankees game, and my dad popped in Robin Williams live on Broadway. And that was the moment I fell in love with stand-up comedy. I would actually memorize his CDs, and I would quote him to no end. But yeah, I would quote him, I would memorize, and eventually I went to a creative and performing arts camp.
How often do you do stand-up comedy now?
Every day. I do open mics all the time. I'm getting up at least like 3 or 4 times a week. I'm writing constantly, which I have a notebook in my pocket always. I have 14 books full of jokes. Not all of them good, but that's what comes with stand-up comedy. Not all of your jokes are going to be good. And
so something that seems humorous to you may pop into your head, and you think about it and quickly write it down so you have it.
Yeah. Mitch Hedberg, who was a great comic, also dead, would say, I write jokes for a living, and I sit in my room and I think of something funny and I write it down. Or if the pen's too far away, I convince myself that the joke ain't funny.
Great line.
Thank you.
Great line.
Yeah. Now, once again, I memorize comedy CDs.
You mentioned your parents, your family. How have they been helpful to you through this whole process?
Love and support. My parents also reprimand me, and just, they love me no matter what. And my little sisters also support me. And knowing that they're there for me helps a lot. It also, you know, I don't want to embarrass them. So I do my best at everything I do, except for schoolwork, which I hate, but.
Everything else you do your best.
Exactly. A student, by the way.
Way to go. There might be somebody out there watching
Okay.
who had some of the early signs and symptoms of schizophrenia, or perhaps their parents are watching. What do you say to them?
It's not your fault. I thought, and you definitely can't handle it alone. Because I thought I could. I was like, I'm gonna get this done, and I don't need anybody else's help, and I just drowned in it. The symptoms just got worse and worse, and I would blame myself. I was like, wow, I brought this upon myself. And to the parents, also, it's not your fault. It's just the luck of the genetic drawer. And get help immediately, because that's the only thing that's going to help. You gotta do all you can to help, even though you weren't the cause of it. It's just the schizophrenia. It's just what you have. It's the hand you're dealt with.
Well, you certainly have been dealing with that hand in a way that's inspiring for people. Daniel, tell us your favorite joke.
My favorite joke one of my favorite jokes of mine is, you know how big Legoland is?
How big?
It's a couple of blocks.
That's a good one.
Thanks.
Thank you.
Thank you so much.
Next, Dr. Patrick McGorry, whose work has played a critical role in the development of safe, effective treatments and innovative research in his home country of Australia and around the world. Pat, welcome. Thank you for joining us today.
Thank you, Jeff.
You've done a lot of work to bring about changes in the system, and I'd like to ask you to speak about that.
I had the chance to set up a research unit in a psychiatric hospital in the mid-1980s for young people experiencing their first episode of psychosis. And immediately we saw everything that was wrong with the system. They were being brought into settings where the average patient was 45, and it was the most disabled group of patients that they were surrounded with. And these 18-year-olds, 21-year-olds were presented with a very bleak picture of their future. They were being over-medicated. They weren't being provided with any psychosocial care. And it was a recipe of despair, really. And so we could see we needed to change all that. We needed to give them a lot more hope and optimism. We needed to build the evidence base for psychosocial treatments. We needed to use the medications in a much more careful way. And probably another major thing was we saw how late they were presenting. We saw that they were presenting after often months and years of being seriously ill, but not able to access care. And they were often brought into their first experience of care through a disaster of some sort, whether it was a suicide attempt or an aggressive incident because of frustration or substance abuse, perhaps complicating things.
They weren't being brought in for help.
No.
Or encouraged to get help earlier on. It's almost as if the person waits for a full-blown heart attack instead of seeking medical care because they're having chest pain.
Well, that's a great analogy, actually, because in no other area of medicine do we do this. With whether it's breast cancer, the first sign of a lump or the first hint of chest pain, people are encouraged to and help to get access to care very quickly. In psychiatry, it's been the opposite. Don't bother us until it's life-threatening, and then maybe we might help you. And it's not the fault of people working in the mental health field, it's the fault of the underfunding and poor design and resourcing of mental health care.
What should parents be looking for in their children as a potential early sign that they should seek help for their child?
Well, one of the things that we've done in Australia in recent years, it's really building on the success of the early intervention movement in psychosis, which is now coming to the States through the RAISE programs and so on. But we've gone another step further over the last 10 or 15 years, and we've built something called Headspace, which is a national program of youth mental health, located in primary care settings. So it's like a one-stop shop for young people, teenagers, young adults up to 25, who are experiencing problems. And we don't say what kind of problem you have to have. We don't say it must meet these criteria or it has to be this level of severity, otherwise you can't come in. We just say, if you've got a problem, we have a listening ear and we have the right youth-friendly place to come to. So that's a very important part.
So the doors are always open.
The doors are always open, and young people have a major influence in the way these programs are structured. You can see it in the community. It's a visible platform. It's a shop front called Headspace. It's in 100 centres in Australia now, and it's a portal for stigma-free mental health care for young people. So that's the first thing. You've got to have somewhere for people to go that they can trust. And then, I suppose an earlier step, to be fair, is how do you recognise when you do have a need for care? And 50% of young people will have some kind of mental health problem as they make the tortuous transition to adult life, from being a child to being an adult. It's challenging for everybody, and we've got to work out when it's appropriate to sort of seek help. And I would say if there's distress involved and it persists, we don't care what the label is. Come and have a chat. Come and talk to us, and we'll give you some information. We'll get you some peer support, and we'll work out together whether you need more expert help.
So this is an important point, that 50%, half of people during adolescence will experience some bumps in the road.
Yeah.
Many of them, they'll get over it, they'll be fine. Some of them may be fine, but with additional assistance.
Yes.
And it's better to err on the side of caution.
Yes.
And seek help. Don't suffer in silence.
That's absolutely right, Jeff. And some of the scaremongers that we have in the world say, if it's 50%, somehow that's just normal, it's teenage angst. But we know that a lot of these young people can fall by the wayside very badly if it's not responded to. We know that teen suicide and suicide in young people is a very high number, so it's much better to err on the side of caution. Some of the reasons people have been worried about overreaching, I suppose, is because if they think the first response is going to be medication. Now, that is not our first response. Our first response is to listen, support, provide information, and provide psychosocial sort of interventions and support first. And medication does play an important role with a minority of young people, but it's not the only thing that's on offer. And provided we can do this in a stigma-free setting, without labelling and without, I suppose, preempting the future, then it's completely safe, and actually it's a very responsible thing to be doing.
If there's a person watching right now, whether they be a young person themselves, concerned, thinking maybe I need help, or family member, what do you say to them?
We know from research that the young people reach out to someone they trust. It's usually a friend or family member as the first step. So I just encourage them to take that first step. As I think it was Chairman Mao said, the longest journey begins with a single step. Well, this is a really good example of that. Reach out, take that first step, and do it with someone you trust. And hopefully the people around that young person know what to do next. That's one of the things we learned from our research with young men. Teaching and training that second circle, as we called it, the second circle of people around the young man, who often finds it very difficult to reach out, the young men in particular. That second circle can make it a lot easier for that young man to reach out. And then they have to educate themselves, how am I going to help my mate? What am I going to do? And so there's a training or a learning task for the whole community here. How do you help someone that does reach out to you?
If we see somebody on the floor with an injury, we all gather around and help them and call an ambulance and do what needs to get done. And this is no different.
Yeah, it's no different. But people feel a little bit ashamed about reaching out for help. They still feel like it's a sign of weakness in some cases. But and then the people around them don't know what to do. They're a bit confused and maybe a little bit frightened in some cases, especially if the person's angry. It's easy in some ways if the person's clearly distressed and anxious and tearful. That's our natural response is to help. But if someone's irritable or angry, which is one of the symptoms of mental ill health, especially in young men, it pushes people away. So maybe see past the anger and say, why is that person angry? How can I help?
The anger is just a symptom of an underlying problem.
It can be, yeah, very much so, and especially in young men, and especially in young men with depression. And if people have had very tough experiences in life, which create a kind of chronic frustration as well, that's something that we can help with. But we've got to see past the anger to see the pain and provide some connection and help.
Key is don't suffer in silence, seek help.
Seek help. And also I think the wider message for our community and our political leaders is make sure the help is there. Make sure there's something positive there, an expert in nature to help. I mean, just like we've done for cancer and heart disease, in those areas, there's no question that if you seek help at an early stage, you're probably going to find it.
So potentially there are medications, nutritional approaches that can be helpful that really don't have anything on the risk side and could have tremendous upside in terms of health.
Well, that's the hope, and we're working very seriously on that in a number of places around the world now, including Australia.
If somebody does have that first episode of psychosis, obviously we want to treat that right away, as you just described. What do you do afterwards in order to minimize the risk of a relapse?
Yeah, well, the first thing is, as you said, to reduce the treatment delay to an absolute minimum. So if you're going to have the heart attack, you've got to get to the person very fast, so that some of the negative effects, which are mainly psychological and social, actually, don't occur. Having done that, and if you do that, you do improve the long-term outcome. We know that now from Norwegian research. But then the story is just beginning in a way. We have to look after that person, just like we do in cancer, until they're better. We give them every chance of getting better. We don't cut the treatment short and kick them out of the service before they're really well or they've reached the best level they can actually reach. And that involves a whole range of things, holistic, team-based care, just like in cancer. Medication by that point is a key part of it, but not overuse of medication. Very low doses, very carefully prescribed. And then psychosocial interventions, including these days, making sure that the young person, and they're typically young, gets back to school, gets back to work with support. We used to say, take a year off, don't stress out too much. But now we say, don't lose your place in your peer group, in your...
It's healthy to re-engage as soon as possible.
Absolutely. We want to normalize the whole thing. We don't see people with psychosis as people from another planet. They're just normal young people who have got a particular challenge, and they should stay with normal life.
And I think a key point is this is a very common problem. And a significant percentage, we cite 1% of the population, 1 out of 100 people having schizophrenia. And anything that can be done to decrease the people who progress to schizophrenia or make sure their outcome is as positive as can be has a tremendous impact.
Yeah. In fact, I always say these days economists are our best friends, because with the, not just schizophrenia, but the array of mental health problems that we experience, 50% of us will have a mental health problem at some point in our lives. It's the biggest threat to the world economy in the next 20 years, according to the World Economic Forum. It's right up there with cardiovascular disease, and it's twice as impactful as cancer. Certainly with the serious mental illnesses like schizophrenia, even with existing knowledge, we could do an awful lot better. And then there's discovery, discovery of new treatments, which mental health research is so critical for.
So a key point is research brings a lot of hope for the future, but current knowledge, if used properly, brings a lot of hope as well.
Absolutely. I think I would give a hopeful message to every single young person that I see for the first time who fits the picture of schizophrenia or psychosis. Hope and optimism is not only essential for survival, but it's justified.
Pat, I want to thank you so much for all the work that you've done and continue to do, and thank you for joining us here today.
Thank you, Jeff. An absolute pleasure.
Unfortunately, many psychiatric illnesses, such as schizophrenia, have an early onset during the teenage years and early adulthood. new approaches to identify early warning signs, initiating treatment before problems escalate, and engaging the young person in decisions about his or her care provide hope for a healthy, productive, and happy life. Remember, do not suffer in silence. With help, there is hope. Until next time, I'm Dr. Jeff Borenstein. Goodbye. With help, there is hope. Healthy Minds is brought to you in part by the American Psychiatric Association Foundation, the Graham Beck Foundation, the New York State Psychiatric Association, and the New York State Office of Mental Health.